Hi, my name is Jules, and today I'll be doing an IV insertion and IV removal. But before I start, I'm going to be demonstrating how I would set up my IV. Alright? So, also, before I start, I would need to, before I do start setting up my IV, I'll perform hand hygiene. And I'll make sure my IV is closed. Also, before I would set up, I'll be checking my bag for expiration. I'll check to see if my bag is expired. It's not expired. I'll be checking if there's any protrusions, leakage, or anything of that sort nature, which there isn't, so I could continue with my setting up. Alright, now I'm going to flush my it's not all tangled. Close that up because I'm not ready to flush. Now I'm going to flush my IV bag. I wouldn't be putting it on the floor, but I would also I would actually be putting it into a trash can. But for the situation purposes, we don't have that. Alright. Now I'm going to enter my patient's room. Hi, my name is Jules, and today I'll be your nurse today, and we're going to be inserting an IV. But before I start, I'm going to wash my hands, provide privacy. Alright, but before I start, I need to check your 5 rights of medication. First and foremost, can I check to see your verify your first and last name? Alright, date of birth. Alright, do you have any known allergies? Do you have allergies to betadine, chloroprep, or latex? You don't? Alright, that's good. Now, I'm going to be checking indeed it's the right time, because I did check it's the right time. Now, we are going to be giving the medication in the right form, which is we're IV, and we're the final thing is right person. I did right person, right time, right medication. All right, now I'm going to start with my IV. I already performed hand hygiene. Also, I need to wash my pigtail before I start because my hands will be busy. Alright, I'm just going to insert about 2 cc's. Alright, I did notice the normal saline flush through the pigtail, so that means my pigtails, I can't use it. My stuff is just falling all over the place. Alright, I cap this back. Alright, now I can continue with my IV insertion. Alright, I'm going to clean the set, find my vein. Alright. Clean the site. Allow this time for it to dry. And also, I wanted to let you guys know that my tape is already prepared for later on. I'm going to be checking my gauge, my needle. It is a 22 gauge. Right. Up. I'll be going in at an angle. I feel a pop. Now, my needle's no longer gonna be going in. The only thing that's gonna be going in is my blunt tip. Also, what I wanted to, my hands are probably covering it. What I did is once I felt that pop, I no longer went in at an angle. I slanted my needles at a more toward like a linear angle. Okay. Now I would dispose of this into the sharps container. Alright, also to pop my tourniquet. Alright, then I would put on my pigtail, and then now I'm going to flush, and this is checking to see if I'm actually in a vein. Alright, I didn't see any bulging or any of that nature, so that means that I am in a vein. So now I could go ahead and tape. Alright, now what I need to do is I need to connect my IV extension set. Alright, Now that my IV insertion set is connected, I want to tape it. Okay. Also, I wouldn't want that to happen, so I would have to tie it a little bit tighter. Alright. I will tape it down here just to give my patient some room. Mr. Jones, are you doing okay? Okay. And then now, finally, what I would do is I would date, time, and initial my tegaderm, which I've already done. And I would apply my tegaderm. Alright, now I'll clean up my area. Throw this away. I would actually throw this away, but since I do not have a trash, I'll be throwing this away after I end my video. And then clean up my needle. Alright. I've already disposed my needle into the sharps container, and I would wash my hands and exit my patient's room. Now I'm going to be demonstrating removal of the IV. Alright. I'm going to be getting some gloves. Alright, now I'm going to first make sure that my IV is closed. It is closed. Now, apply some gloves. I'll verify my patient. Hi, my name is Jules, and today we'll be doing, we will be removing your IV. I bet you're glad. But before we do start, can you verify your first and last name for me? Alright, your date of birth. Do you have any known allergies? Okay. Now we need to continue and start removing the IV. Okay. First and foremost, what we need to do is, like, after I finish closing my, making sure that my IV is closed, I would want to take off all my tape. Like I said, all this would be going into the garbage. Okay. Also, so now, in the slow motion, I'll take out of my blunt tip, apply pressure, and I'll be checking to see if my cannula is intact. If my cannula is intact, I'll be applying my pressure on my patient's arm for a while. Then I would apply my Band-Aid, which I don't have, but in reality I would. And then what I would do is I would just throw away all my materials. And that's the end of my video.